the Erectile Dysfunction Podcast with Ashton Cohen.
Welcome back to the Erectile Dysfunction Podcast with Ashton Cohen. I'm Ashton Cohen. I'm joined today by Dr. Keith Smith. Dr. Smith is a medical doctor, an expert on healthcare policy and reform, and the co-founder of the Surgical Center of Oklahoma. So we're going to talk about essentially why the healthcare system in the U.S. is so screwed up and expensive. And we should mention, to be fair, we actually do have some of the best doctors and specialists in the world here. And so much of medical innovation around the world happens in the United States. But we have this incredible problem when it comes to costs, probably going to get worse with a potentially looming doctor shortage and the baby boomers sort of reaching their elder years. So we're going to discuss why things are so messed up, what we could be doing differently. And Dr. Smith is the perfect person to ask for that. So really appreciate you coming on, Dr. Smith. Thanks for being with me.
Thanks for having me.
So let's start off with a macro overview. The U.S. spends more on healthcare than any country in the world. Our healthcare costs as a percentage of GDP are higher than all the advanced nations. Often in case it's double what the other advanced nations spend. What to you are the biggest sort of contributors of this healthcare cost crisis? Why is healthcare so expensive in the United States? What are the biggest factors behind it?
Well, first, I would caution people to be careful with the statistics that you cited about the percentage of GDP and per capita. A lot of places in the world, the spending on medical services is less because the people actually don't receive it. The statistics are also skewed because a lot of babies that are born prematurely are not even given a chance in many foreign countries. They just don't utilize and spend the necessary resources to attempt to prolong their life or save their life. So here in the United States, that is not the approach. And that's one of the reasons that it's expensive. Having said that, the reason that medical services are so expensive in the United States is government intervention and government regulation and all of the favors that the auctioneers in Washington, D.C. have passed out over the years to the well-funded folks in the healthcare lobby. Their physicians are partly to blame for this, but the primary blame, I believe, lands on Washington, D.C., and then on the institutions like the hospital lobby, the insurance lobby, big pharma. They all are this in the middle blob that costs so much money and interferes with the normal exchange that would occur between a buyer and a seller. The person or the institution that is selling a service and the individual or the proxy buyer who is buying that service. And the problem we have is all these intermediaries that are involved that are profit seekers and have basically bought these favors in Washington, D.C. So there's this crony cartel, basically, is what we have in the United States. But that's just half of the reason that so much money is spent. Half of the medical service delivery system in the United States is already socialized. If you take Medicare, Medicaid, Indian Health Service, and the VA, and you add all that up, that's about half of the system in the United States. So it's already government run, it's already socialized. So we're really only talking about the other half of the system. And there are very well-connected people who pay a lot of money in Washington to make sure that this system stays dysfunctional because it's that dysfunction from which they derive their profit. The good news is people are starting to wake up to this, and they realize it's a scam. They realize they've been had. And short-term, I'm kind of a pessimist. Long-term, I'm very optimistic. The free market is there. It's always there, and it's reared its head. And even the big dogs in the industry are having to take notice of it. It's a very positive development.
One of the criticisms a lot of people have is that they say, our insurance companies, and there's only a few major ones who control the whole market, they're a substantial reason why we have, an inability to know the price of things. They make things unnecessarily expensive. We'll start off with there, then we'll go to the hospitals. But one of the things I always wonder about the insurance companies, so maybe you could explain sort of how that works. What are the factors associated with insurance that makes things so unnecessarily expensive? But why, in some cases, you have these hospitals, we've all seen it, like, on the news, or we've seen loved ones or deal with it, and it'll be, exorbitant amounts of money for routine procedures, right? Why are the insurance companies okay with that and not trying to cut those costs just out of self-interest? Like, why aren't they stepping in and being like, oh no, you can't charge, $500 for Tylenol or whatever it is, or thousands of dollars for this routine thing that took 2 minutes to do?
Yeah, that's a great question. It's actually very insightful. You've done your homework, or you wouldn't have asked that question. I actually did a video called "The $100 Aspirin," which really explains this. Let's back up to the passage of Obamacare. In that bill, there was a requirement that insurance companies could spend no more than 30% of their revenue on administrative costs. And that clause was placed by the big insurance companies who were at the table because they knew that they could endure that regulation and all of the little companies could not. So if you're a gigantic insurance company, 30% medical loss ratio can be absorbed. But if you're a small insurance company, it cannot. And the big guys knew that. That's why we only have 4 or 5 insurance companies left. That's why they all went away. We had all this consolidation. And whenever you see industry consolidation, the black hand of government is behind the curtain, just taking bribes. So the way it works is this: a hospital that claims to not make a profit. Of course, keep in mind, not for profit just means doesn't pay tax. That's all it means. So a not-for-profit hospital bills $100,000 for a procedure, probably one at my facility that we would bill $6,000 for, and we're making a profit. So they bill $100,000, and Blue Cross, United, Cigna, Aetna, take your pick, they pay that hospital $20,000. Well, that hospital then claims that they lost $80,000. Well, that helps maintain the fiction of their not-for-profit status. And I'll come back to what else they do with that $80,000 fictional loss. Keep in mind, I would provide the same procedure at my facility anesthesia and surgeon, for about $6,000. So when they say they lost $80,000, it is really a fictional bookkeeping entry. The insurance companies are happy to play this game, and all of these fees and rates are pre-negotiated. So none of this is a surprise to either party, whether it's the insurance company or the hospital. The insurance company then goes to the employer group, who they probably represented on that claim, and said, listen, we got this bill for $100,000 from this price gouging hospital. And we rode in on our white horse and we reduced that bill to $20,000. We saved you $80,000. And per the terms of our agreement, we share that savings with you at a rate, and it's usually about 28%. So if you think through that, the insurance company is actually mortified that bill wasn't $200,000, because all that would do is maximize their commission. So the insurance companies want no part of price transparency. They want no part of reasonable fees, because through this process that's called claims repricing, they skim off of that discount. So that is an additional source of revenue. So if you're a logical person and you think, like I did years ago, insurance companies collect premiums, they pay claims, they keep the difference, and that's their profit. It's not that simple. They actually take gigantic bills, apply false discounts to them, and skim part of that discount off for themselves, in addition to collecting premiums and paying claims and keeping the difference. So insurance companies work very closely with the hospitals. The hospitals desperately want to pump out these gigantic bills so that they can report fictional losses and maintain their not-for-profit status. And the insurance companies love those giant bills. That's why they hate me. They love those giant.
Yeah, wow.
Yeah, it's a total scam, and there's more. So the hospital, having claimed this $80,000 loss, throws all of these fictional losses in a big bucket and ship it off to Washington, D.C., where our legislators and Medicare actually pay them a kickback to the extent that they claim these losses. And that's what's called uncompensated care. It's also called disproportionate share hospital payments, or DISH payments. I learned this in a heated discussion one time with a normally pretty close vested hospital administrator who asked me how much of my revenue at Surgery Center of Oklahoma was uncompensated care. And that really confused me, because uncompensated care is care you would deliver for which you're not compensated. No, this uncompensated care is a significant revenue item, and it is derived from claiming all of these fictional losses. So that is about as quickly as I can explain that scam in a nutshell. Now, the brokerage houses and the brokers who sell these insurance plans are also in on the scam, because they are paid typically at the end of the year a commission that is a percentage of claims. So if an employer has a terrible year and they have many multi-million-dollar claims, the brokers are popping champagne corks because Blue, United, Cigna, Aetna, take your pick. They are paying that broker a percentage of the claims made on any particular employer group that broker is associated with.
So let's say I'm an employer. I have 100 people working for me. I go through a broker to get Blue Shield or something for all my employees. Is that right? I go through an independent
That's right.
broker? Okay.
That's right. Or, yeah, and so the broker is paid a commission based on what sort of a disastrous experience you've had with Blue Cross.
Say my employees racked up, it was a bad year, they racked up $1 million worth of health care payments. So then the broker that's good for the broker because the broker will get a percent of that million. Is that how it's calculated?
A percentage of the claims made. That's exactly right. And the reason for that is Blue, United, Cigna, Aetna, take your pick. They are going to take those numbers and they're going to come back to that employer and they're going to say, next year, because of last year's disastrous experience, your premiums are going up 20%. And the broker gets a piece of that. So it's horrendous. It's awful. And the enemy of this scam is the light of day. And the light of day in this industry has taken the form of visible pricing. So now a patient can look on a website, Surgery Center of OK, surgerycenterok.com, or the Free Market Medical Association. How much is a hernia repair? How much is a tonsillectomy? How much is a gallbladder surgery? How much is a cochlear implant or a total knee? Take your pick. And they have a number. And it's not just the number for the hospital or the surgery center. It's the number. It's the cash out the door, all-inclusive number. And then they can go to their local hospital and say, here is $5,865 for a gallbladder removal. Can you match that? Well, hospitals are not used to that. They do not want to compete. They do not like that. But they also know if they don't match it, that patient is going to walk out and get on an airplane and fly to Oklahoma City or Indianapolis or any number of places where prices are transparent. So half of the patients that I see at Surgery Center of Oklahoma come from out of state for exactly the reasons that I just stated. And employers will pay all of their travel costs to come see me and pay 100% of the bill. The patient has no out of pocket just to avoid the price gouging hospital down the street. That doesn't happen very many times before that hospital begins to step up and match, because it's going to get out of control if they don't. So that's what the market is doing in this country, in the industry, and that's why I am optimistic. I'm seeing this every day. Surgery Center of Oklahoma is the beneficiary of the predatory pricing of many hospitals. It's been great for us, but we really are on a mission to make sure that even the price gougers begin to toe the line and just quit ripping people off.
Yeah. So, I mean, the example you gave of, first of all, we've seen many times the nonprofit work can be very profitable. And it reminds me of one of the great sort of tax scams that rich people do, where they'll commission artists to paint something. It'll get appraised by one of their buddies for, $20 million for a piece of shit little artwork. And then they'll donate to a foundation. Then they get to write off $20 million off their taxes. So it's kind of a very, very similar scam. The reason why we haven't had price transparency pretty much anywhere until recently, now you start to see more of it, is because of this sort of people's, the different industries' interests aligning, right, with the hospital's insurance, that there was no reason to have price transparency because everyone was sort of making money off this good deal. Is that why that developed?
That's one major reason, is that everyone's trying to maximize their revenue in this industry instead of actually provide a value. And they're able to do that because the competition is limited through certificate of need and licensing laws and all the other stuff. There's another reason. In insurance contracts, invariably there is a clause that says, it's Blue, United, Cigna, Aetna, and Medicare has this too. You may not offer anyone a price lower than the one negotiated in this contract.
Oh, right. Okay.
Or your contract is null and void, and then you are now out of network with Blue, United, Cigna, Aetna.
That's unreal.
So the carriers, actually, insurance companies reach across the line to tie the hands of the institutions, the surgery centers and the doctors. I don't have any insurance contracts at Surgery Center of Oklahoma. We've never taken a dime for Medicare. We just don't do business. We think the government doesn't have any money that is not stolen property. And so we don't accept stolen property as payment. So that's how we look at it. We don't have any insurance contracts, and so none of that applies. There is some talk about preventing insurance carriers from placing those clauses in the contracts, binding the people who sign those contracts. I don't know how I feel about that. I think people just ought to stop signing those contracts and stop dealing with those goons. That's what we decided to do. So,
right.
Yeah. And
so to put a finer point on that, so your doctor says it's a weird, like it's not even a price. It's like a floor price control, which is like I don't know, it's a cross between communism and crony capitalism. It's very odd. So you go to a doctor, and if he's taking your Blue Shield insurance or whatever, and he can't give you the service for less than whatever Blue Shield says he can give you, and if he disobeys his master, then they'll just cut him off, and now he can't take any more Blue Shield patients.
That's
just
right.
For giving a lower price.
That is exactly right. And
unreal.
So envision the patient in the waiting room, and they really cannot afford this outrageous insurance unless they embrace some crazy deductible amount that they can't even come up with. So somebody's thinking, the only way I can afford this crazy insurance is if I have a $5,000 deductible. And I don't know how I'm going to come up with the $5,000, but I darn sure don't know how I'm going to come up with the $1,500 a month I'm going to have to pay to have this policy. So this patient is in the physician's office, and the physician would like to offer that patient a price that they can afford, but he can't. He has to inflict the insurance company rate on them.
Even on non-insured? What if they're non-insured? Then can he make a special deal with them?
Absolutely.
Okay.
Absolutely. Yeah. If they are not bound to a contract with a carrier, they can. Now, some lawyers have made the case that insurance is there for the patient to use or not use as they see fit. So that's why they're called beneficiaries. And so they can use it or not. But the physicians who are contracted with that insurance carrier, they have to be careful that they don't extend too much charity, to a patient who maybe is having some trouble in one way or another.
Isn't there also a rule when it comes to like pharmacy where if you tell them you have insurance, they have to have it at a certain price, but if you don't tell them that you have insurance, then they can give you, maybe a lower price? That's
correct. And that's what I advise all patients is you first ask for a cash price. Don't ever tell someone that you're saddled with Blue, United, Cigna, Aetna. Don't ever reveal that, because you're immediately placed at a disadvantage and a financial disadvantage. Just say, I'm a cash payer. How much is my lisinopril? How much, for whatever drug. And the price that they'll tell you is astonishingly low.
Right. And in the surgery context, so I understand it, let's say, there's a surgery that you need, it's going to cost let's say $20,000. Okay, and then you have, let's say, a $10,000 deductible. So it'll be $20,000, let's say, with insurance maybe, and then you'd be on the hook for 10 grand. But then they can go to a place like you or someone else, and you're going to be charging like 1/3 the price. So in that situation, sort of makes sense just with the cash deal because of that high deductible, and because if they're making a claim, maybe their insurance goes up next year. Is that kind of the calculus for a lot of people?
That is, and we will file a claim for a patient as a courtesy. They pay us our fee, and then we will file a claim for them or give them the information they need to file a claim. And sometimes the insurance company will actually reimburse that patient, so they get some of that money back. Or at least help them meet their deductible. But that's hit or miss, as the insurance companies are more and more aware that patients are going outside of the system and outside of the network. They're digging in pretty hard, and they're not wanting to honor any sort of claim that's made in that way.
I see. And with respect to this price transparency stuff, it seems to be like the last few years where I've sort of heard of it become a phenomenon. You think, is this something that many hospitals are doing, or a small percent of our country's hospitals?
In 2009, I launched our website to put all of our surgical prices on a website, put it online. And I had 3 goals. I wanted the people who actually bought medical services who had sticker shock, I wanted them to better be able to find us. I also wanted to start a price war. I wanted that not-for-profit hospital to account for 10x what I charged. And the third thing I wanted to do was better understand the scams that were at work. Because I'm a free market guy. I mean, if you're cheaper and better in the United States in any other industry,
right,
then there's a lot of demand. I mean, there should be a line around the block for what we do. And there wasn't. I mean, so there was something wrong. The market was being thwarted, and I didn't understand it. And I don't pretend to understand all of the scams, but I understand some of the ones which I've described a little better than I did. So in an almost last act of defiance, I launched the website in 2009, put all of our prices online, and the first patients that arrived were Canadians. Well, that's interesting. You know, they all have insurance. They have government insurance. They just don't have access to the care that so many of them need. So here come the Canadians. Here came the uninsured. Here came the self-funded employer groups. Here came the cost-sharing ministries. And here came the people that had insurance, but whose deductible was multiples of my entire all-inclusive price. So this really became a movement. And we started seeing patients traveling in from other states. And there were hospitals who were getting their pocket picked by this website launched by this surgery center in Oklahoma City. Then there were some legislators and some think tanks that got very interested. And we got some national news coverage and some real notoriety. And next thing I know, I'm connected to an economist at Vanderbilt named Larry Van Horn. And this is his passion, is patients who are being bankrupted with unreasonable fees. Well, the next thing I know, this guy named Donald Trump gets elected, and he calls Art Laffer, famous for the Laffer curve, and says, we've got to do something about these medical prices. And Laffer says, you need to talk to Larry Van Horn. He's the expert. Well, Larry Van Horn basically crafts and writes the executive order that Trump signed that mandated the hospitals had to post their prices. I got invited to that signing ceremony, and I was there. And it was very significant. I'm actually against all government mandates, including that one. And Larry and I have had some very spirited conversations about that. But the one thing I'll say is that executive order changed the narrative. You know, up until that happened, a lot of people, you included, had not heard about even the possibility that a price could be posted online.
Right. What a concept.
Yeah. And I had a tinfoil hat on my head for having done so.
Yeah.
And so now the narrative has changed. Now a lot of people in the United States are wondering, why in the world can't they tell me how much my colonoscopy is going to be? You know, why can't they tell me how much my ear surgery is going to be? And so now the light is shining on the price gougers and those who are resistant. So most of the hospitals in the United States have ignored this executive order and are not posting their prices, or the prices they are showing are meaningless. And so this is going to be a continual battle. But those who are willing to step up and say, like every other industry in this country, here is what I do and here is what I charge for it. They are really going to increasingly distinguish themselves in the marketplace. And I believe the American people, who are great shoppers and they know a value when they see it, and they usually know a scam when they see it, they are going to patronize those who value them as customers and don't just see them as prey to for these predators.
Right. And there just needs to be a little bit of an opening, which is kind of where we're at right now. And then the floodgates can open. We've seen this other industries that were very, very regulated. Taxis come to mind, right? And then like as soon as Uber started going, it became a unstoppable phenomenon. We've seen it with a few other stuff as well. One of the interesting things, and I was having a conversation with somebody last week, is they were talking about how they and people they know, they'll go to Mexico. Mexico is like the height of like crony capitalism. But in terms of being able to buy like prescription drugs, you can just pay like, a tenth of the price. It doesn't involve insurance. You're in, you're out. And so it's just amazing that America is so much more dysfunctional in that respect than a place like Mexico, right? Which is, the height of dysfunctional governments in this hemisphere. What do you think could change? So assuming, well, we'll start off here. If you agree with the premise that we should have, health insurance companies in the United States for maybe, crazy, unforeseen events that are going to cost a lot of money. Like, how would you sort of set the system up? What would make most sense in order to stop these negative externalities associated with our healthcare insurance system?
Well, the government just needs to start examining all that it has done and start repealing all that it has done. Because it's the government intervention that has provided the opportunity for the sleaze bags to just rip the American people off. So all of the legislation that Washington has passed in the last 50 years that pertains to medical services has directly contributed to lining the pockets of the cronies and taking money out of American people's wallet.
If you could also include your sort of view of the Affordable Care Act, how that also has made things worse in your minds.
Yeah, the Affordable Care Act is one of those bills like HIPAA, the privacy. HIPAA has nothing to do with privacy, and the Affordable Care Act, we all, in my end of the world, we call it the Unaffordable Care Act. It didn't have anything to do with affordability. It drove prices through the roof because it caused a consolidation of the hospitals. I'll tell you a story I heard from an insider who was at the table when Obamacare was first ponied out. So when Obamacare was first proposed, everyone in the industry was opposed to it. And they all got together and they were in DC. There was a big round table. All of the industry representatives were there in locked armed, kumbaya opposition. Well, one by one, those chairs started to empty. And people started asking questions. Well, where did the American Hospital Association go? We thought they were against this. Well, the American Hospital Association has been very, very threatened by physicians owning hospitals. So the Obama administration knew that. So they said, listen, we know you're opposed to this, but we would like to get your support. What will it take? We were kind of thinking if we banned the construction or expansion of physician-owned hospitals, that would help. And the American Hospital Association said, you have a deal. And wow. Then they were no longer in opposition. Well, the insurance companies said, what we would like to do is limit our competitors. So they said, well, why don't we just have a medical loss ratio that will put the little guys out of business, and then you four will have it all to yourselves. You have a deal. So, and then if you look at United stock price before and after Obamacare, that is a shocker. Then sure. Big Pharma said, well, where did those guys go? So the Obama administration called Big Pharma in and said, listen, so many drugs are going generic that we don't really see, prescription drugs as being a great source of profit for you going forward. What we see as real profitable for you are specialty drugs. And Big Pharma said, well, yeah, we would admit that's correct. And your real problem is competition from foreign manufacturers. And yeah, that's right. Well, why don't you support Obamacare and we will just ban foreign imports of specialty drugs for 20 years? And Big Pharma thought that was a good deal. They shook hands. Big Pharma walked away from the table. And the next week, the FDA declared all foreign biologic drugs unsafe. So that's how this stuff happens. And so, what's wrong with the prices of specialty drugs? That deal. What's wrong with the price of insurance? Obamacare. And I'm not a system fan. I don't like the idea that a system is good for everyone. My friend Jeff Deist at the Mises Institute says, we don't talk about a food system. We don't talk about a shoe system. You allow the market to work, and those who satisfy the preferences of buyers, they do well. And those who guess incorrectly and don't bring value to the buyers, they go out of business, as they should. So, when you talk about a healthcare system, I think we really need to be skeptical of any sort of system answer, because a one size fits all, I don't think it's a good approach.
Right. Absolutely not. Absolutely not. And, one of the most problematic aspects of all this is it's, as you mentioned, so much removed from being a free market. It's very much, it's closer to a Chinese model than it is to a American capitalist model, where you have a few favored corporations who control the old policy, write all the regulations, everything needs to be run by them in order to get their buy-in. And it's disgusting. And it also makes people think, oh, well, this must be a capitalism problem, and therefore we should go with socialized free healthcare. But it's not. The whole, as you're mentioning, the whole problem is the government's manipulation of this otherwise free market, just like we see in education, who've just driven these costs through the roof, created bad incentives, and we're all paying the price.
Yeah, that's a great point. Well, it's not the failure of the free market; it is the absence of the free market that has resulted in the parts of this medical world that everyone hates. And I think that's important for everyone to hear and really acknowledge and own, because then it really makes no sense to throw the keys and the whiskey bottle to Uncle Sam, because it's just, they've been so unreasonable and so irresponsible. And that's the reason it looks like it does.
Right. And I think the time is kind of ticking for this to have solutions to all of these problems, because one of the things I've been reading, and I'd like to see your opinion on this, or your analysis on this rather, you hear a lot about we're having this massive primary care physician shortage coming up, as well as a shortage with non-primary doctors in the tens of thousands of each category, as well as baby boomers, who are the second biggest generation, all reaching their 70s and 80s at the same time over this next coming decade. So that's going to put a lot of stress on our healthcare system. And if we don't fix anything with the price, I can't even imagine what that does to us economically. One of the factors that people attribute to this doctor shortage is burnout. There's, they do studies on this. I saw one by, who was this, the Mayo Clinic, saying that physician burnout is like at all-time high, 20-30% more than it was just a few years ago. There's a lot of that associated with the just having to do all this nonsense with respect to dealing with insurance companies and billing and all that, and taking away from their ability to actually spend time with their patients and actually deliver care. And instead their attention is being diverted towards dealing with all this miscellaneous administrative stuff.
Yeah, so there are two primary components, in my opinion, of burnout. One is what you just described. Equally as important, if not more so, is the hospital employment of physicians. So hospitals buy physician practices, they employ doctors, and then the physician inevitably faces a dilemma. Do I do what is appropriate for this patient in front of me, or do I do what my employer has told me to do? To be more specific, let's say you're a primary care doctor and you are a hospital employee, and the best general surgeon in town to take somebody's gallbladder out or remove their colon cancer is not an employee of that hospital. Well, if you're an employee of that hospital, you are basically required to refer in the family to the surgeon who works for that hospital, even if you know for a fact he's not very good. He's darn sure not as good as this guy across town that is not affiliated with your hospital. So that is the situation that results in what is being referred to now as moral injury, where as a physician, I cannot properly advocate for this patient in front of me who has placed their trust in me to do just that. So it feels fraudulent. It feels awful. And even if people won't admit it, it's there. It's under the surface.
Dissidence. Mm-hmm.
It does. So the hospital employment of physicians, which, by the way, the federal government subsidizes. People should know that a doctor who works for a hospital is paid double. And the hospital is paid double for the services they provide of a doctor who does not work for a hospital. So Medicare pays through the nose for physician services to hospital-employed doctors. Now, the doctors don't get it, but the hospitals use that money to hire more doctors. So once again, very distorted labor market for physicians in the country. And once physicians become hospital employees, they realize, oh my gosh, this is not what I signed up for. I want out of here. And of course, the hospitals make it very difficult for them to exit. So, yeah, the daily grind, dealing with insurance companies, not seeing patients, and then also being an employee of an institution that only cares about revenue and could give a hoot about whether that patient is getting the best care. That's tough.
And what do you make of the criticism that these incentives, where these hospitals get so much more money for certain surgeries, can lead to basically, maybe not even in most cases, a malignant motivation or a immoral motivation necessarily, but they're more incentivized to maybe do things that will get them paid, right? So that aren't maybe necessary.
No, it's absolutely true. It's worse than that. Hospitals actually make more money when everything goes wrong. So, the complicated case where the patient ends up in the ICU and they shouldn't have gone there, that just gins up the hospital charges. They just make more money. So they're not only, the incentives are really just completely wrong. They're not only incentivized to do things they ought not to be doing, but they have no incentive to ensure that any sort of quality is attached to that.
Yeah, I mean, there's that old Charlie Munger quote, show me the incentives and I'll show you the outcomes. So when you have these sorts of awful incentives, you're going to get awful outcomes, and it's our health that suffers.
Well, and the accountability. I mean, show me the accountability and I'll show you the outcomes. Ambrose Bierce famously defined accountability as the mother of caution. So, in my world, we don't have any insurance contracts. People come to see us because they want to come see us. And if we don't deliver, they don't come see us. And then we go away. So we've decided, we're going to put our reputation and our skills out there for the market to judge. And that's exactly what the hospitals and the insurance companies have paid so much money to prevent. They do not want to be in that competitive game where they're judged on results. They want no part of that.
With respect to the doctor shortage, and I'll ask you a couple last questions on this bit. One of the things that my girlfriend went through. She's a scientist. She went through the PhD program and all that. So she works at UCLA Medical School. And one of the things I went through to law school, so there isn't actually like a quota on. Unfortunately, probably for lawyers, there should be a quota, but there is a quota on medical school applications. How many students can get accepted to MD programs? Do you think that needs to change, particularly in light of a doctor shortage and a real aging crisis or real aging demographics that we're having in this country?
Yeah, I'm a big fan of the market, and I'm not a fan of the ACGME, which determines all of those numbers. I think an apprenticeship sort of situation makes more sense. If you have a practice of endocrinologists, orthopedic surgeons, and they feel like, we need to get some help. So let's provide an apprenticeship sort of situation for someone who's in training, or let's sponsor a sharp kid who's graduating from medical school and wants to go into orthopedics. Let's sponsor them into some sort of a training program where it's not federally funded. The ACGME is federally funded. And so, again, this is a real market distortion that is created by the government. I think what we'll see a lot of non-physician people providing care. We'll see more and more physician assistants. We'll see more and more nurse practitioners. And that's going to be the market response. When someone doesn't want to wait 6 months, to be seen for, this or that ailment, that will be the market response.
That makes sense. And we're seeing a little bit of that. So what gives you sort of most hope about our healthcare system going forward? And what gives you most sort of consternation about it?
Yeah, I think I'm most hopeful because the narrative has changed. This whole idea of price transparency even being possible, much less being present, that's a real positive change. I'm also hopeful because the free market does what the free market always does. It crushes and exposes everyone that tries to get in its way. I think I'm hopeful, too, because here in Oklahoma City, the same hospitals that tried desperately to put me out of business are now vendors of mine. So when a patient reaches out to me and says, I've got a brain tumor, can you help me? Well, I can't take care of them at an outpatient surgery center, but I'll call one of these hospitals that previously tried to crush me and say, do you want to help this guy from Florida? Well, yeah. And so we'll put a price together and, I'll make sure that patient gets over to a talented surgeon at one of these big hospitals. So we are seeing those who have resisted this most viciously actually come on board and participate, even though they're staying in the closet. You should do an internet search. Look at UCLA cash pricing. Years ago, when I put the website out for everyone to see, I received many inquiries from people who wanted to copy us and asked, can we copy your website? Can we borrow your web designer? And I was happy to. UCLA did not ask, but UCLA copied my website. If you look, there's a body, there's circles, you click on it, and the writing on the website is word for word. My web designer said you should sue them. And I said, well, no, because then afterwards there will be some gag settlement, and I want to make fun of them like I'm doing right now. So, yeah, look up UCLA cash pricing on one screen, and on your other screen, look at surgerycenterok.com, and you'll see real similarities. You'll actually see word for word they copied it. That's the kind of stuff that gives me hope. That's the kind of stuff that makes me optimistic because, they've copied what we've done. And they haven't done that at UCLA because they're really nice people. They've done that because so many people from California were traveling to places like mine to get their care. The most thing that always creates the most consternation is the federal government. And whenever somebody from government tells me they want to help me, that's when I really start shaking. That's when I know, we're going to have problems. But I think there is an awakening in a way. I think that there are people in government who know that they need to start undoing what they've done and leave town and just apologize to every house they pass on the way and just beg for forgiveness. And I think there's more and more awareness that they're the real problem. But they're always the problem. Government at all levels is always the problem.
We'll leave on an optimistic message then. Dr. Smith, that was a fascinating conversation. Thank you so much for being with me. Where can people learn more about you, more about your practice?
Specifically about me or the Surgery Center of Oklahoma, that's surgerycenterok.com. We're on LinkedIn and Twitter and Facebook. If people want to keep their finger on the pulse of this entire movement in the country, the Free Market Medical Association is worth checking out, fmma.org. That's the tent under which all like-minded folks in this movement gather.
Cool, and we'll put that in the podcast notes so that people can find it. Thanks again for coming on. Really, that was a really. I feel like I learned a lot. I think the audience probably did as well. So, really appreciate you coming on.
Thanks for having me. I appreciate it.
If you enjoyed our show, please click subscribe to stay up to date with our YouTube channel and podcast, and give us a 5-star rating on Apple Podcasts so that we can keep delivering guys some great content. Thanks for listening, and we will be back next week. We're going to talk about the issues that really matter. Our country, our economy, the Fed, QE, GDP, BTC, NFTs, AOC, the CCP, Cardi B, Yeezy, Yellow Socks, Iran, Joe Biden's dementia,
Come on, man!
and probably sex robots. We stand for a free and open debate and exchange of ideas. And if you disagree with anything we talk about, you are a racist and no better than Hitler.
What?
Let's get started.